All right, well, thank you very much, everyone, for joining us. We have a few people online, which is fantastic. This is a kind of webinar really aimed at parents and potentially ex-neonatal patients themselves to see if we can support people in providing us with some research questions that we can then take forward to prioritise as a neonatal community. And this is a joint piece of work run by the British Association of Perinatal Medicine, the Neonatal Society, the Royal College of Paediatrics and Child Health, neonatal nurses, as well as neonatal allied health specialties. So things like physiotherapy, occupational therapy, speech and language therapy, those kind of things. And we're very keen that we have a strong parent and patient, if possible, but certainly parent voice within this. And within the steering group that's kind of trying to steer this process and run it, we're very fortunate to have Emma, who is on the call with us today and who will jump in a minute. And the process is being admirably led by Katie Evans, who is a neonatal doctor who will also take over from me when I stop rambling in a minute or so. My name is Chris Gale, and I'm a neonatal consultant at Chelsea and Westminster Hospital in London, and a neonatal researcher at Imperial College. And my interest is in large neonatal clinical trials to try and answer some of the really difficult questions in neonatology. And that's really what underpins this process here. So what I'm going to do is I'm just going to move on to the next page, which is the agenda for this webinar. And I'm going to hand you over, like I said, to Katie Evans, who is going to introduce it, and then I may jump in again a bit later.
Hello, hi. So my name's Katie, and I'm a neonatal registrar that works in South London at the moment. And I'm going to talk to you a little bit about the aims of this webinar today. So we ran a very similar webinar a couple of weeks ago with looking at all the different people that we want to try and get involved. So as Chris mentioned, so allied health, patients and parents, other doctors, nurses, basically anybody with a vested interest in improving outcomes for our neonatal patients. The webinar today has got a slightly different focus, which is really all about how we can support parents and former patients to get involved, because we understand that when you hear sort of terms like research and that we want you to format a question, it can all sound really overwhelming and like it's completely sort of outside of your own skill set or the things that you feel confident in doing. And we want to really try and make it as accessible as possible, because we really want research ideas. We're not asking you to put together a fully fledged perfectly constructed research trial. That's for the clever people like Chris to do in the future. But what we really want is your kind of experiences, the things that really irritated you when you were on the unit, or variations in practice that nobody seemed to quite know what was the best way to do it. And parents and former patients are in such a strong position to provide us with these sorts of research ideas and research questions, which is why we're so keen to get you all involved today. Have the next slide, please. So as I've kind of mentioned, the sort of gist of this project and why we set it up is because there are huge variations in neonatal care. Different units and different doctors and different nurses do things very differently. And actually, we don't know the best way of a lot of the things that we do in the neonatal world. And the best way of actually finding out sort of more definitively what's the best type of care, so what's the best type of feed or what's the best way to do something, is to look at it in a large clinical trial. The problem with large clinical trials is that they're very expensive, and they're quite hard to run, which is why they're quite expensive. And the funding organisations, such as the National Institute for Health Research, which is one of the big ones in the UK, they look for evidence from the community that research questions are deemed really important. So projects like this, which is formerly known as a priority setting project, really help to convince funding bodies that that research question is important to everybody that's a sort of vested interest in the neonatal world. And there's been some previous projects done in neonatology looking at setting priorities for research, but they've given us very general themes. So things like, could we reduce the incidence of neck, or How would we decrease chronic lung disease? So rather than a specific question that we could look at in a trial, they've given us some really useful overall themes. And this project is hoping to build on that by actually getting some kind of more detailed, smaller questions out. Have the next slide, please. So these are some of the previous ones I mentioned, and it's being done all across lots of different specialties, including in adult medicine. And actually, adults are a bit ahead of us in that they've probably done slightly more of these projects than have been done in neonatal, the neonatal world. So we're trying to catch up, because we know from looking at adults that they are very good at attracting funding to support these big trials, and we kind of don't want to get left behind, and we want to make sure that some of that funding money goes to neonatology, because I'm sure we all agree that that's very important to us and where we work, and for patients and former patients as well. Next slide, please. So the thing that I think, and Emma will back me up on this, it can be quite overwhelming for parents and people who haven't got, even for, to be honest, even for lots of junior doctors and nurses and people that haven't got kind of a formal research background, is that we're asking for the questions to be structured in this format, which is called a Pico format. And this is the bit I think that makes some people just think, oh my goodness, I can't get involved, this is so complicated. But the way we've done the submission software really just guides you through it, and we'll show you that in a little bit. So it guides you through it in a very step-by-step way. But just to get the gist of how a Pico question works, you have your population, and the submissions form will guide you through this. But basically you're saying, do you want all babies, or do you just want babies born at term, or babies born very early? Or do you just want to look at babies with a specific condition, like neck? Or do you just want to look at babies that are only on the postnatal ward, as opposed to babies that are in neonatal intensive care? So your population is kind of who you want to look at. And then you have your intervention and your comparison. So for a lot of these things, it'll be things like, would you like to know if a medicine is better than another medicine? Or would you like to know if a certain type of nursing care is better than what we standardly do at the moment, or a certain feeding regime is better than the standard? So a lot of these will be comparing to a standard treatment, or you can look at two things directly in comparison with each other. So for instance, I think one of the neonatal physios was saying like a certain type of sling for kangaroo care as opposed to a different type of one, is one of them better than the other? And then outcomes are obviously really important. And we've given, again, a preset list of outcomes. So it's really easy for you to read through and think, well, which are the things that are really important to me, or I think are really important to my question? So in neonatology, a lot of the important outcomes will be obvious things like survival. And then some of the neonatal conditions that we see, so chronic lung disease, problems with the eyes and vision, brain bleeding or abdominal problems, infections, and also things such as sort of cognitive outcomes later down the line, or quality of life, or whether there's any adverse events. So all of those options are there for you to pick from. But if you had another outcome in mind, and we've had lots of excellent ones looking at other topics with their own outcomes in, there's a free text box and you can just put your own outcomes in at the end as well. Let's have the next slide, please. So this is an example of a Pico question using a big trial that was done a few years ago, looking at platelet transfusions, so blood product transfusions for preterm babies. And we just broke this down to show how this huge trial, if you break it down, is actually based on a relatively simple Pico question, which is why we think this project will be really valuable for getting ideas. If the more people we can get involved, the better. So the population they chose was preterm infants under 34 weeks gestation. And their intervention was only giving platelet transfusions at a lower platelet count than they compared it to giving platelet transfusions at a higher platelet count. And they looked at quite a lot of the outcomes I've just mentioned, but their main ones they were interested in was survival of the babies, or whether they had any major bleeding episodes within 28 days of their transfusion. So this is an example how a big kind of practice-changing research trial actually could be boiled right down to what on paper is quite a simple question. And that's why we're quite keen to get as many as possible from different people. The next slide, please.
Yeah, thanks, Katie. I mean, I might just jump in here really quickly. I mean, I think it's this, as parents, I'm sure you're well aware of the blood results which your babies will have, and you know, I'm sure some people on this call have had babies that had blood transfusions, and platelets are obviously really small parts of the blood which help the blood stop bleeding, basically, so they help the blood clot. And this is an example of where practice used to vary a little bit. Some hospitals used to give platelet transfusions when that dropped below 50, and some when it dropped below 25. And by doing a trial where they compared those two, they found out that actually it's much safer to only give a transfusion if it drops below 25. So kind of paradoxically, the lower value was a better value to use to give a blood transfusion. So more is not always better. And as Katie said, this is just a really good example of boiling down an important clinical question into a nice simple format using this P population intervention comparison outcome format. And it's a little bit medical, and hopefully we'll come on in a minute to some examples that may be a bit more, which have come more from parents, so a little bit kind of more focused on maybe some parent priorities as well. Not to say that this kind of thing is not obviously important to parents as well as doctors and nurses and everybody else. Anyway, sorry, I'll stop rattling on, Katie.
That's okay. And if I could grab the next slide, that would be great. So just in terms of how this project works, if you choose to get involved, and we hope that you will, the first phase is just submitting your questions. And as we said, they don't need to be fully formed, perfect questions. We just want you to put in things, your sort of bright ideas, and submit them into the question tool that we'll show you in a moment. We want as many different questions from as many different people as possible. So we've had over 100 already, and we have had some from parents and as well, which is really, really good. But we would love to have more from parents, which is why we're kind of speaking to you all today. Once you've submitted your question, we will have a look through them and just sort of get rid of any double sort of duplicates that people have put in the same question, or anything that's completely unrelated to the neonatal project, which hopefully we won't have too many of. And then after that, we'll move on to the next process, if I could get the next slide, which is we're going to sort of email back to you and get you involved in then looking at the whole list of these research questions, and then saying, so not only the one that you've submitted, but also the ones that everybody else has submitted, and actually saying which ones are most important to you. So by submitting a question, not only do you get to kind of contribute your own ideas of things that you'd like to see answers to, but you also then get to help prioritise this whole long list of questions as to which you think are actually most important. So it's a really lovely way of seeing lots of other people's ideas and concerns and things that they wish they could make better. And by together all kind of re-ranking and ranking this list, we'll come out with a final list of prioritised research questions by the wider neonatal community, all sort of agreed and ranked together. And then, like I say, these will hopefully go on to add weight to funding applications, and hopefully some of them will then go on to be answered in large practice-changing research trials, which is what we really hope. So if I just grab the next slide. This is just to say, so there's a lot of people that have been involved in this project, and we're really trying to cover all the bases in terms of everybody that looks after babies. So as we said, nurses, doctors, allied health, parents and patients. But today we're really focusing on parents and trying to make it as accessible to parents and former patients as possible. So at this point, I'll probably just hand over to Emma, who's just going to talk a little bit about the project from her perspective and that of a parent. And then me and Emma will just talk through together one of the examples that Emma came up with, and I'll try and show you how we submit that on the software. And then we can go through some questions from people and try and submit anything else with people that they want to do kind of from there.
Thank you, Chris and Katie, much appreciated, and thank you for the background, and yeah, please don't let any termination terminology, sorry, put you off at any point, because we are running this to help you to be part of this piece of work. So as Katie and Chris have both suggested, we're really keen to hear. It's not just about the medical and the medicine. We're really keen to hear now, at a time where so much is changing in neonatal. We've got some great opportunities. Parents are really being encouraged to be core to those changes with the teams through various PAG groups and Maternity Voices partnership groups. And this is just an opportunity to be able to get an answer to some of those questions that, like Katie said, if things were done differently between your hospitals, or you just had a question whilst you were on the unit, or your parents were on the units where they just couldn't quite get the answer to the question that they were asking. So it's a really good opportunity. And once you see this example, I hope it will become less scary to you, because it was less scary to me after I saw this. And actually, it's a really user-friendly system. So yeah, and hopefully we can just help you just with a few little bits, just to be able to input those questions and take anything from yourselves to see if we can put it into this format. And please don't think anything's right or wrong, or that it might have been answered before. Just put it in is what we would all say, because the panel will go through those. So yeah, Katie, if we could do that example, because I'm going to ask a lovely question.
Yeah. Right, let me see if I can share my screen again.
And I know I can see a couple of people on the chat that I recognise, and thank you. They've come with their neonatal voices hats on, so they look as though they've got CCG emails, etc. But they are neonatal parent voices, and thus they do have some neonatal experience themselves.
Katie, do you want me to share my screen?
It might be easier.
I'll do that. Let me quickly.
Yeah, sorry, my apologies. I'm doing this from abroad, so I'm not having quite the nice internet setup.
Katie? You are
No, I'm in Chile at the moment, so
on holiday.
Yes, yeah.
Bless your heart. That's dedication. I just want all the parents on the call to know that this little webinar was just as a response to me being quite petrified, and they've been so accommodating through this project, and I've said that I haven't understood. So thank you for running this, both of you. Really appreciate it.
No, it's fantastic to have you here as part of the team, Emma. It's been, yeah, it's great, and hopefully we can demystify and make this a little bit less kind of scary, this process.
It would be great, because the other perspective of this is obviously that when we're on the units as parents, somebody comes up to us and says, we'd like you to be part of the clinical trial. You know, demystifying it will help with that as well, because I certainly know that I kind of sat upright and thought, oh my God, do you want me to consider something else, you know? Yeah. So it's good to know that, you know, parents are involved in these things, and the background behind them. So thank you. So Katie, can I give you my question? I know that so many of us talk about how hard it is when our babies are born and then get whisked away. So my question, well, what are the advantages of enabling supporting delivery room cuddles? So I know, so with population.
Yeah.
And Katie and Chris, remind me when on which of these questions we can only select one. I think on this one we can multiple choose the ages, can't we?
Yeah, so this one we can put lots of different gestational ages in.
And from a parent's perspective, who might not know when it would be viable to be able to have cuddles, can they put all the ages, or would you suggest just taking a stab at it?
I think it's, I mean, you can pick whichever gestations you think the question's most important for, I guess. And, you know, I think one of the reasons for doing it is to find out whether there are any, you know, whether there are babies that maybe it's not suitable for. That would, you know, I guess that's the reason for thinking of this as a research question.
Yeah.
Should we go right down to the lowest gestations and then?
Yeah, that would be amazing.
And, you know, is there a gestation where you think it's not really a question, they should just do it, really? I guess that's the other, you know, when you get to say 32 weeks and above, you know, maybe is it something that...
Yeah, I would prefer to include them, Chris. I don't know what other people think, but I know that I had mine at nearly 32 and they were taken away still. So it would just be good to have it as part of the trial to say, actually, this is a good thing.
Should we go up to 35 weeks then, which I guess is most of the babies that will go to a neonatal unit?
Yeah, amazing, thank you. And then, so you're asking for location there, aren't you?
Yes.
So, if people can't see it, we're talking postnatal ward or transitional care, neonatal care or community, and we've also included neonatal transport in there. But if not within one of those, then you can put something else there.
So, and it's delivery rooms, what we're talking about here, isn't it? I think, is that right?
Yeah, definitely so. Thank you. And then we go down to, so I see that you do have, please detail any further population definitions there, so you do have a free form there as well. Intervention, so this would be the difference between baby being placed on mummy at time of birth and not.
Okay.
Or is that, would that come under intervention, Chris, or is that comparison?
So yeah, I think what you were wanting to look at was babies that were given a delivery room cuddle. So they were initially stabilised and then given a cuddle with mum prior to being transferred for neonatal unit care, wasn't it? So I think, I mean, you could technically do it either way around, but I think you're saying that this is the kind of intervention, the thing you actually want to look at, and what you're comparing it to is perhaps more historical traditional care, where the baby would get stabilised and then immediately transferred to the neonatal unit without that moment of kind of cuddled or contain holding with mum or dad.
Is that right, Emma?
Yeah, no, that sounds perfect. Yeah.
So if we say baby placed on mother for delivery room cuddle before being transferred to neonatal unit, and then we can just have baby not placed on mother for delivery room cuddle before being transferred for neonatal unit. And I guess, yeah, sorry.
Yeah, sorry, no, you go, Chris.
No, I was going to say, and I guess the next thing is the outcome, really. And, you know, we've put the outcomes here that we did some work, and as Katie said earlier, we work with lots of parents, actually, as well as doctors and nurses and allied health professionals and researchers to identify which outcomes are really important to everybody. And those are the ones listed here. But it may be that actually there's another outcome like safety that's actually really important here.
And I suppose I would ask here, you know, you know, does it influence survival, and does it prevent all of those things? You know, yeah, I know that's quite a large ask, and it goes as far as I would ask, you know, what does that do for parents' mental health and even mum's ability to be able to produce milk when it's a couple of months before she was supposed to.
Does that look okay?
Yeah, that looks great. I think a couple of people are struggling with the echo in the comments.
Sorry about that. I'll mute myself. I think that helps if I mute. Okay, are we happy with this? Shall I finish and submit this one?
Yeah, that looks great. I don't know if anybody else has got any comments on that one, or whether that makes it slightly clearer, or whether there's any other questions that people would like the team to help with. I think that you can see that they were really helpful guiding me on that difference there. But I think we understand that if we put the detail in the question, then we'll be able to identify what we're trying to achieve. So please don't be scared of the tool. Did anybody else want to jump in with a question? It sounds as yes, it's better now, everyone's saying.
If I'd be very happy to go through and submit another question on the system if someone wants to someone's brave enough to talk up. If not, maybe we can come up with another one. Oh, brilliant. Sarah,
question.
Fantastic. Please just unmute and talk, and turn your camera on if you like, but don't feel you have to.
Hello. So for my question, I'm speaking as a bereaved parent. My son died from a neonatal herpes infection, which wasn't treated at all. So he never received any antiviral medication. And I know that's something which varies a lot in practice between different hospitals. So my question is kind of, should all sick babies be treated with antivirals, like as a preventative strategy? I know they are in some hospitals and they're not in others. And I know a lot of babies up to between 20 and 50 are dying from this every year.
I'm sorry to hear your experience. So just to try and put this into the form that we're using here. So really, I guess you mean babies at any gestation who are sick, is that right?
Yeah.
And so babies, any gestation who are sick on the neonatal unit, or?
Yes, it would be neonatal unit.
Yeah. Do we mean unwell and being treated for infection? Or being
well, I guess that's admitted as an unwell baby, because they won't necessarily be being treated for infection. But they won't necessarily have signs of, like the typical signs of HSV.
Yeah. And then the intervention is routine antiviral treatment in addition to antibiotics?
Yeah, exactly.
Sorry, my spelling's awful.
But it's too small to read anyway.
Oh no. When we did this and Katie was typing, it was much more impressive than my slightly suboptimal typing here.
Should it be specific in these boxes that it's babies that don't necessarily have, because they need to be treated within like a day or two of infection, and at that stage they won't necessarily have had a diagnosis.
Yeah.
I don't know if we need to be more specific. It would be obviously all babies with a diagnosis are going to be treated with antivirals.
I've just added into the population definition there, baby who's unwell and admitted to a neonatal unit without a specific diagnosis.
Yeah.
And it's standard treatment, well, it's routinely adding antiviral treatments to the antibiotics is the intervention. And then the comparison would be standard treatment without routine antiviral.
Yeah.
Okay. And which outcome is the most important?
Survival is the most important. Yeah. And I'd say quality of life.
Yes.
Would be the second most important.
And are there any other ones like brain injury on imaging, or how they think later on, vision, hearing, are those kind of things important too?
I think they're all important, but not the most important.
Okay. Fantastic. That's a fantastic question. I will submit that now. Thank you very much.
That gives me one less job to do.
Yeah, fantastic. Brilliant.
Can I just ask you both? So for the situation with Sarah, where Chris has kindly put that in, will Sarah get any notification? She wouldn't get further notification about the studies.
Yes, I was just going to say, so if Sarah could either just, my email address is on the website, either just drop me an email with her email address so that I can link her into the follow-up bits. That would be great. We can leave the question submitted, but just so I've got her contact details so that we can copy her in, that would be really useful.
Amazing. I'll try and pop your email in the chat here, actually, Katie. I'll do that. Thank you for that. Did anybody else have any questions that to the team for some help? Worries to parents and family.
There's one. Yeah.
Shall I read it? Or
Yeah.
did you want to come off mute to? Julia's put, I wondered how a question on the barriers to parents and families that prevent them being able to spend time with their baby on NNU. I realise it would be a quantitative study, but helping health professionals understand the seen and unseen barriers may help forward understand how precious time can be for families when on the units. The understanding may also help consider the feelings of guilt displayed by some families when not able to attend NICU and often as they would like, which on occasion may be exaggerated by staff expectations.
So I think this is a really great question, and it's a really important question, and I think this recognises something which we've talked about quite a lot, which is that these questions that we're trying to formulate here using this quite standard approach of population, intervention and comparison and outcome it works really well for clinical trials where you're trying to compare one thing to another. But of course, there's lots of other types of research that are really important as well, and qualitative research asking questions as to why people do things in certain ways and what people's lived experiences are equally important, but don't lend themselves so much to this kind of question. We are focusing on ones where you can do a comparison just because it would be too big a project really otherwise, and we're definitely thinking about how we might try and identify important qualitative questions or questions where we're asking how common something is. Those are a slightly different type as well. But what we could do with this really important question that Julia, that you're bringing up, is we could try and form it into a question where it's a comparison, because it seems like there is a comparative question maybe in there, and do jump in if I'm completely wrong, but it seems like there's a question around if we can find a way to get parents to spend more time with their baby, is that maybe the intervention we're interested in here. So is it a question of comparing, a way of getting parents to spend more time on the neonatal unit with their baby with maybe what exists at the moment where they maybe don't get to spend as much time, and whether that changes some outcomes for those babies?
I think I was trying to get across. Sorry, hi, I'm Julia. I'm actually a care coordinator, but want to help support our regional PAG to be able to submit questions. So I thought it was important for me to come along and see how we could do that.
Yeah.
So it's really kind of like trying to help staff to understand that, yes, we're really pushing forward with family integrated care, which gets parents on the unit an awful lot of the time. But there are a lot of expectations on parents that, I have heard parents say before, I know my baby's safe, but my toddler needs picking up from nursery.
Yeah.
And we need to understand the extra pressures that are there for families and be able to help support them with that. Now, whether that means that we set up nurseries is a different matter. But it's just kind of like, I didn't quite know how to lend the question to the application on the tool that you're showing. And does that make sense?
Yeah, no, it makes total sense. And I think the example you've just given is one way to do that, because you could make a really nice research question, which is something like, parents of babies, less than say 32 weeks, so the more preterm babies, or maybe less than 34 weeks, does giving, free additional childcare for other siblings, compared to, currently, as we don't do that now, does that help improve their bonding with their baby, or does it make breastfeeding rates higher, or does it actually make the babies more likely to survive, or do they have a better quality of life later? I mean, that may be maybe that's a way of forming that question into something that we could compare in a trial.
Okay. Okay, I'll perhaps have a look at the tool with PAG and see how we can work something out with that then. Thank you for your help.
I hope that makes sense. I mean, we can put it in now if you like, but very much it's you know, thinking about what are the things that would let parents be on the unit a little bit more where they feel they currently can't do that. Because as you say, there's a whole host of things, isn't there? Or very reasonable reasons why people can't be there maybe as much as they like, especially if it's not their first baby.
It could also be travel, of course.
Yeah, exactly. Yeah.
And that brings us consideration of other religions and cultures as well, doesn't it? Where in some cultures, mum is supposed to rest after having a baby, so it's those initial discussions, and it's a good thought-provoking question. I can see Kelly's put a comment in the comments about bliss. I have got an ongoing project to determine the barriers to parental involvement. Will hopefully support healthcare professionals to understand and reduce these barriers. So I know there's loads of great work going on at the moment surrounding this and all the work that we're trying to do. I
was going to jump in as well with the previous question that we were discussing from Kelly, and just was sort of saying you could do something as well when you're talking about staff. You could even make the question formulated such as your intervention was a targeted education package for neonatal staff, looking at their preconceptions and awareness of difficulties and barriers for parents, compared to not having an education package for staff, and actually whether that improved outcomes and care and bonding and the things that we looked at. So there's loads of different ways of phrasing the question, and the thing I think we just really want to get across is, please don't worry too much about perfectly formatting it. Just put the information that's important to you down into the tool, so that we've got your kind of interests and your areas of kind of concern and insights recorded for us. So just there's lots of, like Chris was saying, there's lots of different ways of doing it. So try not to worry too much if you're supporting parents about it being perfectly formatted. It's more just kind of the general ideas that we really want to get.
Can I just say thank you, Katie, because the idea of the training package, I think that's a way of sort of like working through it as well. Obviously, along with Blizzard, I knew was happening. It's more about sort of like how do you phrase those questions. But I think you're quite right. It is not so much about the parents, but it's about the training that we give to the staff to understand the parents. So thank you for that.
And there is another question in the chat. I don't know if I haven't got a full name there. If that person wants to jump in.
If not, I can read it out. Wondering on how to word a question. Oh, it's Nicola Johnston. How to word a question on how long from low sugars at birth were babies diagnosed with hyperinsulinism and given treatment for this? Would it be better to add a timeline, i.e. within 2 weeks or within 1 month? And also how to include it to see if there were any brain issues and things noted later. So I think this is asking around, some babies have persistently low blood sugars because they produce too much insulin. And often as doctors, we know that there's a kind of a type of babies often will have low blood sugars early on, and then that will just resolve on its own. But some babies this continues, and they're the ones that generally get called hyperinsulinism babies, and there is a type of specific treatment we can give for that. And I guess there's the timing about when you say, oh, this is just part of kind of normal baby adaptation, or when we start to say this is this condition, hyperinsulinism, and start treatment. I think that's maybe what you're asking about, Nicola, is that right? Yes, and I think and the way you could form that into this question is you could say, you know, this is often term babies, but it could be babies of lower gestations as well. So you might want to make the question term babies and close to term babies possibly. And it could be around the point at which we start treating for hyperinsulinism. So early diagnosis and treatment at say 2 weeks, and maybe later diagnosis and treatment, leaving a little bit longer, and the outcome may be brain imaging abnormalities, or it might just be how baby develops afterwards. That might be one of the ways of doing that. Does that make sense, Nicola? Or am I completely off the mark here?
No, that does make sense. It's just that it was more because with us it took a while because our son was born because I had very high blood pressure, and then my treatment was then blamed for him having low blood sugars for quite some considerable time, and then it was found that he actually required to have diazoxide fairly quickly. Okay. And obviously now he's now over 2, and now we're wondering whether there are actually further issues having been caused by that with the long-term low blood sugars for as long as he had them. And now obviously he's still not speaking, and now we're wondering if there's anything else involved. So I was just wondering if there's anything we could do that would obviously include maybe the hyperinsulinism community, because they're obviously very underfunded and have lots of questions about these things because it's quite unusual to have this. So
yeah, no, absolutely, and we would really value questions coming from the hyperinsulinism community, absolutely, through this process. And it, as you say, it's not as common as having a premature baby, for example, but that doesn't make it any less important. And this process, the idea of this process is to get questions from all areas of neonatal care and bring them together so that we can then at least have those questions there, and then we can use them to maybe think about how we can undertake research to address questions that affect even smaller numbers of babies. That's that's all part of the process. So we'd really value questions coming from the hyperinsulin community.
Yeah, I was wondering that because we were a bit of a mixture because he was 7 weeks early, so we were in NICU anyway because of my high blood pressure. But then obviously this was then found out fairly quickly, so it's a mixture of the two. And it was just lumped on as it wasn't me, it's this, and it was a very, very quick jump from one to the other. But I'll happily, what I can do is I can happily go onto the hyperinsulinism Facebook page, and I can kind of share this once you know what you're doing, and once we figure out how to fill this in, I can share it with them, because I'm sure there'll be many parents may inundate you with a few questions.
Great. Well, I'll put the link in the chat now, and please do put it on the Facebook page, and please do invite people to come and submit questions using that process. That would be fantastic.
Excellent, will do. You might regret saying that, to be fair.
No, I don't think so. I don't think so. We want to get as many questions as possible. And for this process, we're trying to put them into this form, this comparator form, where we're comparing one thing with another. But even if they come in and they aren't quite in that form, they'll still be recorded, and we'll still use those questions. They may not come through to the next stage, but definitely we're gonna make sure that all of the questions that come through are highlighted and are made available, so that we can think about how we could undertake research for all of these questions, even if they're not necessarily in a kind of comparing one thing to another format.
Grand, thanks.
Great. Any other questions from people? It's been fantastic to hear people's kind of processes for thinking through these research questions, because we recognise it's certainly not easy for doctors, nurses, health professionals, researchers, parents, patients, anyone to form things into this kind of format. So I think we just want to make it as easy as possible so that we can get what are really important questions recorded, so we can then start to think about how we answer them.
Chris, I wonder if you could do another example for me. And again, this might not go into the format, but I think this is why we're all here, because we can't quite understand whether they go into the format. But I was wondering, with non-identical twins that have to be have an emergency C-section with early, how the and this might be something that's already out there, but the steroids, the steroid injections, I'm not sure how to put the question, because one of my twins needed breathing support when they were born and the other one didn't, but I only managed to get one of those steroid injections in. So I was wondering I completely understand that some people have to go into C-section too early to get them both, but do we fully know the impact of ensuring the steroid injections are both received, and can that time between them be cut down if needed to? Do the benefits of bringing the second dose forward outweigh the consequences of not getting the second one in?
Okay, so that's really interesting. So I mean, and I guess the question is this just twins here, or is this something that you know is an important question for all premature babies, I guess?
Yeah, exactly that. Yeah.
And it seems like this is premature babies up to maybe, I guess, 34 weeks or something along those lines.
Chris, do you want to share your screen again?
I'm sorry if I unshared my screen. Thanks, Kate.
And
yeah.
Abby has.
Can you see that again?
Yes, thank you. And Abby's popped in the comments that she would be interested in single births as well as twins with this.
Yeah, so I'll put so babies born at these lower gestations, and really we're thinking about, so we're thinking about maternal care, aren't we, actually, because it's about steroid injection to the mum.
Yeah.
And I guess the other detail about the information here is so these are babies where the first dose of antenatal steroids has been given, but delivery is imminent before the second dose is due. Is that right? Is that what we're talking about? Yeah.
Yeah, amazing. Thank you.
And the intervention would be giving a second dose of antenatal steroid early, and the comparison would be current care not giving a second dose. Okay, and then the outcomes.
Thank you. I mean, obviously the RSV and the chronic lung disease, yes, survival.
Yeah, and I guess bleeding in the brain, quite important, and steroids probably protect against that.
And I suppose that the question is that it's really good for us now. If we don't know to select some of those other things, could they be selected for us? Because obviously we wouldn't necessarily know all of the things that could be benefited from those.
Yeah, absolutely. I mean, there's no or just pick the ones that are most important. I mean, we've tried to make it as easy as possible by listing outcomes that people have reported as being important in the past. So if these are the key ones here, then I'll finish that. And the idea behind doing this work around outcomes was to say that these outcomes are so important that really any trial or research should look at them, because everybody agrees these are really important outcomes. So to some degree, the outcome part of it's not so important, because I think we all accept that actually any big study should look at all of these things in babies.
Yeah, that's great. Thank you, Chris. And yeah, and I suppose it's just illustrating that everything that comes under family integrated care that we're talking about so much at the moment. Can you think of some questions that are applicable that fall under that area as well? It doesn't have to be, I know I've brought up steroids again there, it doesn't have to be medicalized. It can be about that family integrated care.
Yeah, no, thank you. Please do. So questions about particular bits of family integrated care would be really important. So, you know, and I think some of that's touched on by this idea of free childcare and making it easier for parents to visit. You know, but you're right, maybe is it, you know, how important is education of the different ways of educating and involving parents that we might need to think about, you know, to compare one way or another. Sarah's got another question here, which is, does it make a difference to the ranking of a question if more than one person submits it? I.e., should I ask doctors we are working with to also submit a similar question? So you, by all means do. So by all means ask doctors to submit questions that they think are important. That would be really important. That's absolutely key. The ranking of a question we're not going to do at this stage. What we're going to do is we're going to take all of the questions that people put in, and then we're going to ask everybody to rank them at the next stage. So everyone will get a chance to rank them compared to other questions. And there won't be any kind of additional weighting if a question is submitted more than once. We'll just wait for that to come out in the ranking process. So putting it in again and again isn't going to make any difference at this stage. So you don't need to do that. Once it's in, and it'll go through to the next stage as long as it's in this form, this Pico form, to allow comparison.
And just to pick up on that, so part of the reason we're so keen to get people involved in submitting a question is then you're automatically going to be involved in the ranking. So if you've got colleagues or doctors or people you work with that you think would be interested in being involved in the ranking that have similar, you know, interests to you and are therefore likely to prioritise some similar things, then it's really important to encourage them to submit something so that they're automatically contacted when we start doing the ranking stages.
There's another question just come through from that's from
that's
you?
me. Sorry.
That's all right. Great. Well, I'll try and put it in again here.
Thank you.
Okay. I'm putting my age in here, just so you know, not anyone else's. Okay, great. So this question around involving parents in ward rounds. Which group of babies do you think it's most important for, or is it any baby on the neonatal unit?
Yeah, any baby on the neonatal unit.
Okay. And when you say involving them in the ward round, what do you mean? Can we describe that a bit better?
Asking them to present their baby rather than the other way round. Yeah, Abby's just put in parent-led ward rounds.
And if we compare it to kind of the current normal standard where doctors lead the ward round?
Yeah, amazing.
And then the question is, what outcomes? So you say quality of life, is that for the baby, for the parents, for both?
It obviously, if it affects the parents, it ultimately affects baby, doesn't it? That new way of thinking, that it ensures the best outcomes for the baby, but for the whole family. And yeah, their mental health, the mental health of the parents, and their confidence to be able to leave the unit. Because at the moment, parents obviously say if they haven't had to look after their babies, how are they going to be able to do it?
Okay, so I've added in 3 outcomes here. I've put in parental quality of life, parental mental health, and parental confidence in caring for their baby at discharge. Does that about cover it, do you think? Yeah,
that sounds amazing. Thank you.
Brilliant.
Thank you. I'm pleased that one went in. See, you've made it all so much easier now.
Thanks so much, Emma. So hopefully we've shown that. Oh, someone's put their hand up. Fantastic. We've got about 5 minutes left. So please do speak, Kelly. Oh, you're muted. Are you muted, Kelly? I can't hear you. No, you're not muted. Try again.
Well, it's very quiet, Kelly.
1 sec. If not, I'll type.
Oh, we can hear just.
Any better?
We can just.
So I'm a NICU parent myself, and also very fortunate to be a neonatal service user voice. So what I'm hearing lots from parents is more like focusing on longer term outcomes. So the psychological impact of a neonatal care admission on the parents, and then also developmental outcomes for baby.
So I think that's really, really important. And I think lots of neonatology is starting to recognize that what's really important to parents and patients and families is not just the kind of things that happen in the first, year or so. So the core outcomes have got obviously some of the more acute things, so vision or hearing problems, but also things such as obviously brain injury on imaging. That would include kind of follow-up things, and also general cognitive outcome is one of the outcomes that we've got, and that's because previously with the work that Chris did with parents, and that was deemed obviously really, really important. So very happy for obviously those general outcomes, but you could also free text more specific ones. So if you had something that was a bit more detailed, you wanted to look at I don't know, so sort of reading and writing age at school level or something a bit older than that, that's also something we'd be really interested in. You can free text that in the outcomes box as well.
And if you've got if there are any particular things that you would want to compare to look at those outcomes, so if it's saying, is it that a different kind of family integrated care leads to better outcomes at school age, or some of those later outcomes after families have gone home, then that's kind of we're trying to find something to compare against something else for this particular process. Not saying that those other, that just focusing on understanding what the long-term effects are is not important, but for this process we're trying to think about different comparisons. So please do have a look and have a think, and if you can come up with those things, please do submit it online. We're really keen to see as many more submissions as possible of these research kind of questions. I think we're coming to the end, which is perfect timing, which very rarely happens to me. So Katie, you've obviously done a fantastic job in keeping me to time here. Emma, did you have anything else you'd like to add?
No, just thank you both again, and Katie, bless you for being on your holiday and speaking to us. It's much appreciated.
Yes, Katie has joined us from her holiday in Chile, so a very exotic holiday, of which I think we're all very jealous. But thank you, Katie, dedication to the cause. And thank you very much, everybody, for taking the time out of your no doubt very busy day to be part of this, and for supporting this really important process. And giving us your thoughts and experiences. Please do spread the word. Please do. This is open for another week, this process, so please do ask people to get involved, and please do submit questions. And no question is silly, no question is unimportant. Everything is really useful, so just try your best to fit it in, and if it's not perfect, it doesn't matter. Please just submit it through the online system. Lovely. Thank you very much, everybody.